right? So most of us don't really think about what we bought or why we bought it. But if we think about it, next slide, if it's a health decision, that health decision can be really more problematic or harder to think about. Next slide. One of those is issues is risk perception, which we already heard all about, and I don't need to get into. Next one is something that goes with risk perception called optimism bias. So this is us thinking, oh, something bad will never happen to me. And so especially if we are in control of things, we tend to be more optimistic about our chances. So even if we are smoking 3 packs of cigarettes a day, we think that we're not going to have a heart attack, right? The third thing are these psychological issues. So we call these psychographics. So instead of demographics, they are psychographics. And these are usually experiences that people have that might make decision-making about their health different. So it might be that they have higher levels of medical mistrust, let's say. And because they have had bad experiences with the healthcare system, they may make certain kinds of health decisions that they wouldn't if they didn't have that medical mistrust. So those psychographics are important. Next. So my question as a scientist has been, can I take the methods that we get people to buy a Coke, next, and can we get them to buy a colonoscopy? All of us who have had a colonoscopy in this room knows that's exactly what you look like when you have one. Okay, next. So what I've done is try to take from the world of commercial marketing and apply those types of techniques to understanding some of these issues like psychographics and how we interact with the world, and whether or not those can help us create messages that will make people think about their health differently. Next. So one of those things is called segmentation. So segmentation is when we take a group of people and we separate them apart. We put them into segments. Often we do this because of psychographics. You could do it by demographics. Okay, next one. The other thing is perceptual mapping. So perceptual mapping is it's called multidimensional scaling process. It's a type of statistical analysis. And what it does is it takes simple survey data and put it into a 3D method. So next, what you'll have is a group that sits in a 3-dimensional space. And then next, you'll have a decision that you're interested in having them do. And then you'll have all of these different variables that might go into that particular decision. And that allows us to kind of think about how that issue is related to everything else and what you might be able to focus on in a message campaign. Next. We also then do what's called vector modeling. And so this is kind of like a physics model within this 3-dimensional space. It's what can we push and pull against to take that group of people and move them towards that decision that we're interested in. And that actually becomes our message strategy that we then put into some type of campaign or intervention. So I'm going to give you a quick example of this. This is a study that has been done with transgender women who are at high risk for HIV. They're 34 times more likely to have HIV, but much less likely to be on HIV prevention medication called PrEP. And so what we did was we surveyed a group of transgender women here in Philadelphia and in San Francisco, and then we did segmentation where we looked at a psychographic process called patient self-advocacy. So patient self-advocacy is just the idea that, how often are you able to advocate for yourself in a medical system? And for trans women, that might be low, especially if they have a lot of stigma because of their transgender, and they've had bad experiences maybe out in the community or in the healthcare system. So we did segmentation and we looked at people who had low and high self-advocacy. Self-advocacy.
I'm sorry.
I'm not done yet.
I know, I'm sorry.
Almost. So then we did perceptual mapping and vector message modeling. So this shows you what the messages might be for someone who has high self-advocacy skills, who can advocate for themselves, and which messages may be important to get them to think about taking PrEP. And the next one is the perceptual map around using PrEP for people who have low self-advocacy. And so then what we do is we look at this and say, what's our message strategy? Do we need to have it be completely different for these groups? or can we kind of combine them into one type of sets of messages that we can integrate? Then what we did was actually create messages. So this is a campaign that we're in the process of doing now using the Instagram, and we're taking these kinds of things. So this is a comic book, and then the last page is that. And so that's how we integrate commercial marketing into health decision making. Thank you.
We are now open for questions. We are open for questions. Do we have any questions about anything that we talked about today for Dr. Bass? Anybody at all? Any questions? Yes, yes.
Toxoplasmasa, the parasite that lowers risk perception, is that encountered in your
Risk perception for, I'm sorry, say it again.
risk perception at all? 80% of motorcyclists in emergency rooms were found to be infected. And it's the thing with the old cat lady.
Yeah, I mean, risk perception is one of those things that's very individual, right? So for some people, they may experience it in a different way. But if you're a motorcycle driver, you probably have pretty high risk anyway, right? You're doing things that are going to be risky, and you may consider yourself to be safe, even if you're not.
Great, thank you. Do we have another question from the audiences? Any question for Dr. Bass? Yes.
So thinking about how anxiety and risk perception go hand in hand, what do you, or if you have any recommendations in general of when someone has high anxiety about those things and so their risk perception is disproportionate to the thing that they're worried about?
Wow.
Yeah, so that actually happens all the time. So think about all of us at the beginning of COVID, right? Very high anxiety because this was something that was brand new to us. And so part of that messaging is just trying to understand where the anxiety is coming from and trying to address it as much as you can to try and bring that anxiety down so that you can kind of think about what that risk is in a proportion to what is actually problematic for you.